precautions. Patients with transmission-based precautions are placed in isolation. The isolation environment separates the patient with a contagious illness to keep the spread of infection. The room has to be a private room when at all possible. You can imagine there are some psychological aspects of patients that are placed in isolation. First of all, caregivers can be fearful of someone who has a contagious infection. Likewise, patients and families can be fearful and stressed when in isolation. Not only do they fear the disease condition that requires the isolation, but they also are fearful of the practices that must be followed for these precautions to be effective. For example, the personal protective equipment can look quite scary. Special procedures are needed to be followed for handling the infectious waste material. Restrictions are placed on patients' movement outside the isolation room, making the patient feel like they're being cut off from the rest of the world. There also might be possible restrictions on visiting hours and on the number of visitors that the patient in isolation might receive. They're also fearful about passing that infection that's contagious onto their loved ones. As a result, these people need an awful lot of emotional support. Some of the ways that you as a caregiver can provide that emotional support is with active listening, spending extra time with the patient, and clarifying questions or any misunderstandings that the patient or family might have about the isolation situation. Any questions that you're unable to answer, be sure to check with the nurse for clarification. Transmission-based precautions, as I said before, are used in addition to standard precautions. The type of transmission-based precautions that are used depends on the way the infectious pathogens are spread. Guidelines for the Centers for Disease Control and Prevention indicate the specific precautions and personal protective equipment that's needed based on how the disease is spread. There are 3 types of transmission-based precautions. The first is airborne precautions, second, droplet precautions, and third, contact precautions. I will speak about each one of these types of transmission-based precautions individually. Airborne precautions are used for patients with diseases that are transmitted by air currents. For example, tuberculosis, chickenpox, or measles are those type of pathogens. These pathogens are small and light, and they're suspended in the air or on dust particles in the air. They can travel long distances on the air currents or in ventilation systems. All caregivers entering patient room with airborne precautions must wear a special mask. This special mask filters out these small disease-producing pathogens, making it safe for you, the caregiver, to work with the patient. Caregivers are specifically and specially fit with a mask that's called a high-efficiency particulate air filter mask, or commonly called just a HEPA mask. Droplet precautions is another type of transmission-based precautions. It's used for diseases that are spread by means of large droplets in the air. Examples of that might be influenza, strep throat infections, or pneumonia. Ways that they can spread it are by sneezing, coughing, or simply talking. The droplets, however, usually do not travel more than 3 to 4 feet from the patient who is infected. The third type of transmission-based precaution is contact precautions. This is used when the infectious pathogen is spread by direct or indirect contact. Direct contact occurs when a caregiver touches a patient directly on a contaminated area of the skin, on blood, or other body fluid. An example might be touching blood on a patient's arm without having gloves on. Indirect contact occurs when a caregiver touches an item that has been contaminated with infectious material. An example of that might be touching a used Kleenex or a bedpan, again without the use of gloves. There needs to be careful preparation for isolation. An isolation card indicates which of the 3 types of transmission-based precaution is necessary and is determined by the physician that's caring for that patient. An appropriate card is placed then on the door entering the patient room for all to see. An isolation cart that houses all of the personal protective equipment is placed outside of the patient room for easy access. A wastebasket is placed inside the room with a color-coded liner, always red, so that there can be placement of infectious waste in it.